Mercer's mission is to educate physicians to meet the needs of rural and medically underserved Georgia. I literally embody that mission, and I think that's why I've been so successful at this university, is because Mercer has a mission and I have a mission, and the two are congruent. And it's created a number of opportunities that I think will benefit me and my future patients. I chose to pursue a career in family medicine. Family medicine offers the best of primary care to the broadest range of people, and it's arguably one of the most essential components of the healthcare system. We focus on acute issues, chronic issues, and my favorite, preventative medicine, because obviously it's better to never develop a condition than to have to treat one. Another component that I really like about family medicine is being on the front line. Having an opportunity to create the initial interaction between physician and patient is very important, because it affects the way they see the rest of healthcare. After graduation, I plan to begin my family medicine residency at Navicent Health, and over the next 3 years, just really prepare myself to cater to the needs of rural and medically underserved Georgia.
I learned about Mercer when I was looking for programs that catered toward multiculturalism, and in a nutshell, that is what the program consists of. When I was younger, I got into the helping field when I was around 14. I went to the Boys and Girls Club in my neighborhood, and it was for lower income families. Although my family was middle class, I recognized there was a difference between myself and others. And being in the program has definitely helped me grow as an individual. Especially recognizing my own privilege. Although I am a part of multiple oppressed groups, I also recognize that I'm a part of multiple privileged groups, and that has helped me see how I can make a difference in the world and how I can use my privilege to help others who may not be as privileged in the areas that I am.
Being part of the MSBMS program has been a huge blessing to me. The classes have challenged me and have strengthened my pre-medical foundation tremendously, which has helped better prepare me for medical school. I wanted to be a physician for as long as I can remember, and choosing a career in medicine allows me to combine my lifelong love for people with my interest in science and medicine. I chose to go to Mercer because it has a reputation for preparing its students to go out and practice medicine in rural, medically underserved areas of Georgia. And I'm from one of these areas, so Mercer's mission statement really hit home with me. I want to go back to Americus or just another area of Georgia in need of a primary care physician and be a part of the solution to providing healthcare access to those in need.
The MSPCS program has been very vital to me being able to build on the things I need to build on to become a competitive applicant for medical school. And my immediate future is going to be spent studying for the MCAT and applying to medical school this year. And that is with the hopes of being able to start my medical education in 2021. And then the goal from there, my future from there, is to hopefully become a practicing physician and be able to practice in Georgia. I identify Mercer's mission through my work. I managed some rural healthcare practices and even a small OBGYN practice in Swainsboro, Georgia. And not being from a rural area, it really hits home for how important it is for Mercer's mission to be met and carried out. And hopefully one day I get to be a part of helping to carry out Mercer's mission.
I am part of the Nathan Deal Scholarship Program, which was actually started during my first year of med school. This is a program that supports students who are committed to returning to rural Georgia following residency to serve their communities. I had already planned to return to a rural county, but once this program was established, it lined up perfectly with my personal career goals. It's more than just financial support. It's a network of people who are going to help me set up a practice, who are going to be there for me to talk about any problems or obstacles that I may face, and to help connect me with the people who can help me the most. I knew I wanted to go to work with children before I knew I wanted to go into medicine. I do plan to practice in general pediatrics, again in a small town, hopefully in one of the small towns surrounding Macon, so I can continue to be close to home. And even though my residency is going to be out of state, I look forward to returning and serving my home community.